So today we'd both like to share a little bit of a foundation for you to understand our perspectives. And Dr. Koch, as a Chinese medicine practitioner and naturopath, we'd like to hear a little bit more about Chinese medicine, what the philosophy of the medicine is, and then some specifics in regard to anxiety and stress.
Thank you. So Chinese medicine, first I just sort of want to set up the foundation of the training. A Chinese medicine practitioner has a master's level of education, and that takes 3 to 4 years, 1,500 to 2,000 hours. Some of you may be familiar with people doing acupuncture, like MDs or physical therapists. Their training, typically MD has 200 to 300 hours, and they just focus on pain. And a physical therapist will have about 40 to 50 hours, so just really a weekend course, and they do what you call dry needling, and that's really just for pain management as well. And so the understanding is very limited in terms of understanding the theories, the diagnosis, the treatment plans. The World Health Organization really says to be proficient in acupuncture and Chinese medicine, you need at least 1,500 to 2,000 hours of training. So I just kind of want to set that up, and to really find a qualified acupuncturist, you want to go to the National Commission of Acupuncture and Oriental Medicine website, and that's nccaom.org. And they really make sure that the practitioner is accredited and has passed all their certification. So I just kind of want to set that up for the viewer because I want them to really get the proper treatment and to really get the full breadth of the medicine options for them, because today we're really talking about there's a lot of options outside of just what we are calling the traditional Western medicine diagrams. Acupuncture or Chinese medicine really started more than 3,000 years ago. And the focus then was really on longevity and health. And so they really paid attention to really subtle changes in their environment and their diet and how that was affecting the person. So they really could pick up a disease process as it was starting and stop its progression. Today in Western medicine, we don't really pick up those subtle changes until we see it in lab work, and we know at that point it's really progressed quite far. Acupuncture and Chinese medicine, they have several branches. You have acupuncture, you have Chinese herbs, not Chinese herbal medicine. Not everyone is trained in Chinese herbal medicine. That's a different degree, and I am trained in Chinese herbal medicine. So if you're interested in that, you want to find a practitioner who is trained in that. There's also body work. So when you think of Tui Na or shiatsu, that's a category in Chinese medicine. And also there's different treatment type of approaches. There's Qigong, there's Tai Chi, there's different kinds of breathing type of treatments, which are really incorporated in Qigong. And we might want to lay the foundation of how we really look at the world in Chinese medicine. It's completely different than Western medicine. You may have heard of some of the concepts of qi and yin and yang, and those are really the foundation of the medicine. So, maybe the simplest way to explain yin and yang is when you think of a hill, there's a south side of the hill and there's a north side of a hill. And on the south side, it's sunny, it's bright, it's warm, it's drier. And then on the north side, it's more damp and cold. And so the theory is everything, there's this duality, there's this interdependence between yin and yang. And so you'll start seeing all of that in all of the treatment plans. And then there's that big concept of qi. And qi, some people think of it electromagnetic. Other people describe it if you have a sailboat, like an analogy, if you have a sailboat, the wind that moves the sailboat, you may not see the wind, but you know it's moving. And the qi is like that. You cannot exist without qi moving in your body.
I think of it as like vital force.
Exactly,
Yeah.
vital force.
Yeah.
And naturopathic medicine is the vital force. So we we can't really, it moves everything in the meridian. That moves the blood, it moves all the fluids, and if there's an imbalance in the chi, it's really, there's different types of chi, and as soon as you see imbalance, it's usually the first problem that we see before it gets to a bigger problem. And so a Chinese medicine practitioner is really, they're, besides listening to you, doing different kinds of diagnostic approaches by listening, even smelling, right? They're looking at your pulses, they're looking at your tongue, they're asking you really a lot of questions to kind of really just determine where is the chi imbalance, where is the yin and yang imbalance, and that's really the foundation. And then we can get, talk more about the meridians. There's really 12 major meridians that run through your body, and that's where the chi moves through those meridians. And an acupuncturist is really assessing and manipulating that chi. And so it's really vital that they understand how to manipulate the needle or move the needle to either strengthen the chi or reduce the chi. So that's where a lot of extensive training comes in. It's not just, like a physical therapist is just really just kind of stabbing the needle in there, or, I don't like to say that word, but it really is kind of like that. And so it's not really manipulating the chi.
Can you give us a little example about when the chi is manipulated, how that translates to either feelings in the body or tension, or it does impact that, right? That's been my experience.
It does.
Being on the receiving end.
Right. So we do notice right away when we start manipulating the energy or the chi in the body. Usually the person's, the first thing we notice is their digestion. We start seeing them, the rest and relaxation response starts. And in Western medicine, we have a lot of stress. And so people come in with a lot of tension, a lot of anger, a lot of irritability. And so when we're looking at, for instance, like the liver meridian, that's really the first meridian that's affected when somebody's under stress. So we will manipulate the needle to remove that energy and to smooth it out. And you might, see people kind of sighing on the table and just kind of releasing and then kind of just melting into the table. But that is one direct way we can just effectively impact that meridian.
Right. Yeah. I had a mentor once in my training at Bastyr who said, what modality are you going to use to get that person into a parasympathetic state of relaxation? Because that's when we heal. Yeah. And, I wasn't doing Chinese medicine and she was, so she was challenging me in that way. But there are other modalities like cranial sacral therapy or the Qigong or yoga. So there are other modalities.
Definitely.
But my experience with having needles is that sometimes that state of relaxation is very obvious right away. And then sometimes I feel the effect of that a couple days later. Sometimes actually after treatment I've been a little bit energized. But I think that's what you're saying, that the balance that you're looking for, if I'm depleted and have no energy but then feel a little more energy, it's kind of adjusting what the balance of chi is.
Right, yeah, you're bringing more energy into the meridian, and maybe another meridian is too much energy in that meridian, you might direct it to the meridian that's deficient.
Right.
If you're, if whatever meridian is causing you to feel tired.
Right.
Yeah, and so it's a lot of manipulation of the chi, of the yin, the yang, the balance.
And understanding that.
Right, and understanding it, which is a lifelong, studying, really.
And experience.
Experience,
practice.
yes, a lot of experience.
Yeah.